Want to thank everybody for being here. Sandy Kao is a special guest, and she's going to be our speaker today. I'll introduce her momentarily. We also have some other very important people on with us, which I will come around to. First of all, though, I want to make an announcement, and I want to let everybody know that on with us today is the Executive Director of the Sepsis Alliance. Tom, are you on a computer with a camera, or are you calling in? Can you introduce yourself or wave?
So happy to be with you guys today. It's Tom Heyman. I'm the Executive Director of Sepsis Alliance, and very pleased to be with you today.
Thank you so much for joining us. I want to say that we have been working on this for a little while, and it is still September, so this is appropriate, but we received a proclamation today from the governor's office proclaiming September as Sepsis Awareness Month in the state of Connecticut, which we are very proud to have received, and we will make sure that next year we obtain it before September so that we can do a little bit more cheerleading around the state with it and a lot more attention getting, although it didn't stop us from bringing attention to sepsis awareness throughout the month. But we do have a proclamation that Governor Ned Lamont issued today, and we are very pleased to share it with everybody in attendance, as well as with Tom, who I've sent a copy to. And part of the effort that the Sepsis Alliance does in to try to make more people aware of sepsis, which I don't want to read the whole proclamation because it's lengthy, but the bottom line is that Sandy's going to go into, I'm sure, some of the data and statistics. A lot of people die each year from sepsis, and yet most people don't know what the symptoms of it are. And our purpose, our intent is to make people more aware of it, not to scare you, although I am often told that it's frightening. But sepsis is a serious situation. And sepsis used to be thought of as being an infection of the blood, which we know better. It is not an infection of the blood. It requires an infection, any infection in the body. And sepsis is the body's overreaction to that infection. So the body kind of goes into overdrive and it starts harming itself. I'll leave it to Sandy, who is medically trained and much more appropriate to give you that information. But I do want to say that we hope that you will take anything you learn here and share it with others, direct them to our website, direct them to the Sepsis Alliance. We're always here to take phone calls and to receive emails if there are questions. So please do let us know. And with that, let me introduce Sandy. And then I'll tell you a very quick story afterwards. So Dr. Kao provides leadership for the Health Research Education Trust of New Jersey, which has initiatives related to perinatal quality, hospital quality improvement, opioid prevention, HIV prevention, and implicit bias training. Sandy's research interests focus on social determinants of health and improving access and overall health outcomes for African American patients. She serves as a mentor and advisor for various student groups, including Student Nurses for Advocacy and Policy, Black Student Nurses Association, and Nursing Students for Global Health. She has worked with first generation and minority studies to help improve retention in academic nursing programs, and continues to work with disadvantaged populations through education of wellness. Sandy travels once a year to both Ghana and Haiti on medical missions. She currently serves as Director of Education for HEAL, H-E-A-L, Health Education Action League, Haiti. Her project includes the implementation of a pre-licensure nurse residency program to help bridge the current knowledge and practice gap for nurses in St. Mark, Haiti. As a lifelong learner, Sandy is in the process of completing her Doctor of Nursing What's the P?
Oh, well, I have the DMP. I'm finishing a PhD.
Okay. And she has her PhD program where her research focuses on the impact of discrimination on cardiovascular health in African American women. Now, what she doesn't include in her bio is that until not too long ago, Sandy was actually on the Connecticut Center for Patient Safety's board. And it was a full circle because we hadn't talked to her in a little while, so that when she was introduced as the speaker for today through the Sepsis Alliance, it was a very pleasant surprise. With that, I am going to turn this over to Sandy, who is an outstanding educator, a wonderful person, and certainly quite knowledgeable on sepsis.
Well, thank you so much, Lisa. That was an extremely warm welcome. It is a really just full circle for me. I started my career in Connecticut, and I worked as a floor nurse in hematology, oncology, bone marrow transplant. And I was fortunate enough to meet some folks through the Connecticut Center for Patient Safety and join their board and do some of this incredible work that we're really encouraging really across the nation, but in particular in Connecticut, in supporting our patients and providing them advocacy and support through legislation on how we can continue to keep them safe in our hospitals. So thank you so much, Lisa. I really appreciate it. And thank you, Tom, for this opportunity as well. So today we're going to be talking about, I'm just going to make my screen a little smaller here so I can see, what the real crossroads of COVID-19 and sepsis. I think we've learned so much over the last several months, but there's so much more that we are continuing to unveil. And so what are some of the important highlights as we are now celebrating the last day of September being Sepsis Awareness Month, and we have so many initiatives in New Jersey, and other states have also now recognized September as Sepsis Awareness Month. So we're so happy that Connecticut has joined the ranks and will continue to do this incredible work. All right, now computer, don't fail me. Let's see if this will go on to the next slide. Okay, great. This is just some background on me. Lisa, thank you so much for giving that update in my bio information. I currently serve as the VP for Clinical Performance and Transformation at New Jersey Hospital Association. And so a little bit about the Sepsis Alliance. The Sepsis Alliance is the first and leading sepsis organization in the US, and we are currently working in all 50 states to really advocate and to save lives. And really just to kind of approach this from a reduction of not only incidence of mortality, but any type of suffering related to sepsis. Now, this organization was founded in 2007 by Dr. Carl Flatley, and we actually just had a board call just an hour ago, and he was on the call, and he's very much continually active in the organization. So Dr. Flatley unfortunately lost his daughter, Erin, unnecessarily to sepsis just when she was 23 years old. Erin had gone in for a very routine procedure same day, and she was discharged home and anticipated to have a little bit of pain, but unfortunately the pain never subsided. And after two encounters in the emergency room, with symptoms that included high white blood cells, tachycardia, also known as having a high heart rate, and low blood pressure, those types of symptoms that we oftentimes associate with sepsis. Unfortunately, no one had caught on to that. And by the time that they realized what was happening with Erin, it was too late. And she unfortunately lost her life due to sepsis. And I think we all can probably think of, and sometimes, there's a shared experience for those who are passionate in this area. I know I have personal stories. Lisa has personal stories of, encounters with sepsis in our hospitals, or just encounters related to harm, where we have a role we can play to help improve these outcomes. So just some background, what is sepsis? So as Lisa alluded to, sepsis is the body's overwhelming response to any type of infection. Now, this type of infection oftentimes will lead to tissue damage. It leads to organ failure, amputations, and even death. Sepsis is a medical emergency. It requires rapid identification and treatment, and it's really important not only to prevent mortality, but to also save your life, obviously, and your limbs. So who is at risk for sepsis? We know that the very young, the neonatal population is at risk. The very old are older adults, and anyone who has chronic diseases or have any immunocompromising conditions. They are really the ones that are most susceptible. As I mentioned, I worked in oncology, and so sepsis was an area that I battled with more often than I'd like to. And so, and I think any patient you encounter in the hospital can be at risk for sepsis if they are at risk for infection. And oftentimes, if you're in the hospital, you invariably are at risk for infection because there are so many opportunities for nosocomial or hospital-acquired infections. And so we really should have sepsis on every patient's radar to ensure that we're putting in protocols to prevent sepsis. So let's talk about a little bit of the burden of disease of sepsis in the US. About 1.7 million people each year get sepsis. And many don't know this, but sepsis is the #1 cause of death in US hospitals. Think about that. Before today, if you didn't know this fact, folks might have thought, oh, the #1 cause of death, maybe it's heart disease, maybe it's heart attack, maybe it's, pneumonia, flu. Those are things we hear about. There's campaigns, national campaigns. We are hearing so much about national flu campaigns, especially as we approach this twindemic of COVID and flu. But how often are you hearing about sepsis campaigns? And I think that's why it's so important we're doing this work here today. Over 270,000 people die of sepsis each and every year in the United States. More children die of sepsis each year than any other pediatric cancers. Think about that. Again, knowing what we know about pediatric cancer and the wonderful work so many organizations are doing, how many of you have heard initiatives for pediatric sepsis? So sepsis is the #1 cause of hospital readmissions. I recently presented with the Sepsis Alliance Summit, and one of the interesting things we found, in particular in New Jersey, is that readmissions were most common within 7 and 30 days for patients who did not speak English as their primary language. So another opportunity for vulnerable patients are those who are not English speakers. And that might mean that we have to really tailor our education and our discharge planning for these patients when they are going home or going to or discharged to any other facilities, and understanding the proper care for the septic patient. Because readmissions, again, places patients on even a higher risk for reinfection, and there's a huge fiscal and financial burden on hospitals as well. I don't want to misquote, but I believe the figure was about $33 billion spent annually on sepsis. So there's so many implications on why we really should tackle this issue in healthcare. So what about sepsis and COVID? So sepsis and COVID are like any other infection. COVID-19 can lead to sepsis. So more than 60% of adults don't know that sepsis is a deadly complication of COVID-19. I have a personal short story to share. I unfortunately lost my uncle to COVID-19. He was in his early 60s. He was a cab driver in Brooklyn. Our family's from Haiti, so English was not his first language, so he had a little bit of a language barrier. Early on in the pandemic, there was not a real understanding. I think in certain populations, there were a lot of myths around COVID, and so he did not always wear a mask. And he believed because he was in the cab and he had the shield up, separating him and the patient, that he would be okay. Unfortunately, he started to develop symptoms, respiratory symptoms, on a Wednesday, and he had passed by Monday morning. And so one of the things that is really important when you're thinking about COVID-19, many of the patients, but even in particular for my uncle, before we even had a diagnostic test back to confirm sepsis, he had developed an organ failure. He was extremely hypotensive, tachycardic. He was respiratory compromised. He had pneumonia and had been coded several times, and he was in septic shock. And so, COVID has done so much. But again, it's exposed and helped us to really understand, even more important, why sepsis is important. And when you look at this from this lens, not only is it important to discuss and try to improve preventable diseases like high blood pressure, like diabetes, like COPD, that place patients at even more risk for COVID. But we know that these patients, once they develop COVID, they do end up in, again, 60% of the time, end up in some type of sepsis and organ failure. And that places them at a very high risk for mortality. And this is where we look to you for all your expertise and support. So sepsis awareness. In 2020, we did a sepsis awareness survey, and we looked at awareness of the terms of sepsis, reached an all-time high of about 71%. However, awareness of the signs and symptoms of sepsis is low at only 15%. And it's particularly low among patients who identify as Black. Now, why is this important? Again, for some of the reasons that I stated. For especially as COVID-19, we know that even in New Jersey, I can speak for, but we know nationally that African-American and Hispanic patients have the highest mortality rates from COVID. And if there is a gap in knowledge and understanding on the symptomatology of sepsis, then that would delay care. So if somebody who is normally hypertensive is now developing symptoms of hypotension and their blood pressure is low, they might think, oh, my blood pressure is low, so I'm okay, I'm actually doing better. If they are tachycardic, meaning that they have a high heart rate, they might not correlate that with some type of sepsis encounter. So if they have a higher heart rate, lower blood pressure, they may develop shortness of breath. They may say, well, I know COVID is a difficult disease, and I know people who've had shortness of breath, but they told me to stay home unless my symptoms got really bad. So I'm just gonna kind of stay home and figure it out. And we also know that early, not only early awareness, but early intervention for sepsis is key. So really encouraging and educating folks about the symptomatology of sepsis is important. Also, awareness levels of the term varying significantly among racial and ethnic groups, which people who identify as Black reported, again, the lowest awareness of sepsis. So what that means is, as we look at sepsis awareness in our own areas, it's important to, also target communities who may not have a full understanding and awareness of the gravity of sepsis. Here are some other results and some visuals to go along with our Sepsis Alliance survey. Again, we found that within awareness among patients who identified, or people who identified as Black, there's about 49%, and Hispanics, there's about a 63% awareness, and among patients or people who identify as white, there's about a 76% awareness. So awareness of the term sepsis, again, it varies significantly between race and ethnicity. So let's talk a little bit about COVID-19 and sepsis awareness. So the lower levels of sepsis awareness in communities of color is especially concerning. Again, just kind of what I mentioned a little bit ago, Black and Hispanic patients are 4 times more likely to be hospitalized with COVID than whites. And the gap in sepsis awareness between these populations is most likely a result of health inequities. And they may vary in terms of the impact of COVID in communities of color. And so, it's such a heavy lift when you look at the work around sepsis. We can't do the work in silos, and, addressing these gaps in awareness leads us to addressing the gaps within vulnerable communities and health equity. So these are all important conversations for us. And it's about time. So when it comes to sepsis, as I mentioned, time matters. Sepsis takes a life every 2 minutes. Mortality from sepsis increases as much as 8% for every hour that treatment is delayed. So think about that. If you have somebody who's home for 10 to 12 hours, every single hour that passes by that they're not seeking care, they have an 8% increased chance of mortality. As many as 80% of sepsis deaths could have been prevented with rapid diagnosis and treatment. So what does that mean? In order for someone to have access to rapid diagnosis and treatment, they need to have access to a care provider, hospital. They may need to have access to a primary care provider. They need to, social determinants of health is huge here. They need to have the knowledge, education. They may not have the financial means. So we look at insurance and income. There may be the language barriers that I talked about. There may be access issues to travel and getting to the hospitals. So those are all really important factors as we look at the critical ways in which we have to communicate the urgency of seeking early sepsis treatment. So It's About Time is a national initiative to really help create a broader awareness of sepsis and the need to seek urgent treatment. Whenever we recognize these signs and symptoms, it's important that we get patients to the emergency room so that they can get the appropriate antibiotics, the appropriate antipyretics, and all the medications that are essential in order to help treat them. And so here is what we need to look at. We need to look at temperature. So I mentioned antipyretics to give patients the Tylenol, the Motrins, and whatever they need to help their temperature dissipate. A fever is an inflammatory reaction from an infection. So certainly you want to make sure that you try to calm that down. If there is an infection and they have signs and symptoms of an infection, you want to treat them with the appropriate antibiotics. Oftentimes that it's a broad spectrum antibiotic that, we have patients start within the hour of them coming into the emergency room. M is for mental decline. Any patients who are presenting with confusion, sleepiness, difficulty aroused, they might say, oh, I'm just tired. That's an area that you really want to be concerned. And a patient who's E, extremely ill, having severe pain, having any discomfort or shortness of breath. And the story that I shared with you with the founder of the Sepsis Alliance, where his daughter Erin had this severe pain. And oftentimes they're like, oh, well, this patient just had surgery, so pain is anticipated. However, there's a difference between anticipated pain and severe pain and discomfort. So that's very important. So if you experience a combination of any of these symptoms, we encourage folks to seek medical care urgently. That means call 911 or go to the hospital. Could this be sepsis? Perhaps. And if it is, time is of the essence. So we really need to make sure that we educate patients about this. So I just wanted to share, again, if you have any, if you wanted to find out any more information on sepsis and COVID, I encourage you all to check out our website and look at sepsis.org, looking for any frequently asked questions. There's tons of resources and videos. We just had an incredible summit with some nationally known and internationally known speakers in the field and experts around sepsis, and really highlighting the importance of and the intersection of sepsis and COVID as well. So I encourage you to please check the website and share this with your community partners, with your hospital agencies, with your interdisciplinary teams, nurses, EMTs, respiratory therapists, physician colleagues. It's just really important to get this word out. September, again, is Sepsis Awareness Month. This had been launched back in 2011. So every September, individuals and healthcare providers, as well as other organizations, big or small, come together to raise awareness about sepsis. And if you wanted to get involved, now that Connecticut is officially deemed September a Sepsis Awareness Month, please log on to sepsisawarenessmonth.org to download any of the information, brochures and flyers. Now, although September 30th today is the last day of September, or is it? Yes, today is the last. I was like 30 days of September, yeah. So today's the last day. So hey, there's still time to blast this on your social media, especially since this proclamation just came out today. So share this on your Instagram, on your Facebook, on your Twitter, letting them know that Connecticut is really serious and really advocating for sepsis awareness. And so please make time to do that today. There's tons of memes and kind of posters that you can put out there. There's a few visuals and stories and videos. So again, if that's something that you're able to do, please do that. So that concludes, and I realize I speak super fast. So if you have any questions, please jump in here. We're happy to answer them. We encourage you to visit our website at sepsis.org with the Sepsis Alliance and look at some of the incredible work that we're doing. And Lisa, again, thank you so much for this opportunity I'll stop here to see if there are any questions.
Sandy, okay, so if anybody has questions, just unmute yourself and jump in. I'd like to get it going though, because I actually have a question. And I want to point out to people that I think I know a lot about sepsis, but other people, at least 2 other people on this call, know a lot more than me. And as much as I do know, I still come up with things frequently that I don't know. So does treating the symptoms, for instance, as you said, taking like Tylenol or acetaminophen or Advil or whatever to bring down a temperature, does that help reduce the impact of sepsis? Does it slow it down from progressing or anything like that?
Yeah, that's a good question, Lisa. And so, you know, when we talk about timing being of the essence and treating things like fever, it's important, but you remember with Tylenol, what that does is it helps mitigate the fever itself, but it does not address the infection. And so it's one way to help, but it's not going to get to the root cause. In order for us to really make a difference and improve the care for this patient, we have to address the infection and what's causing this. And how you do that is with a proper antibiotic. And so that's just one way to help mitigate the symptoms.
Thank you. Because I think a lot of people, you know, we're taught, you know, oh, you got a fever, take Tylenol, bring it down, you know, and kind of like, do you know if you have an infection? You don't always know. And the story that I have to share is that my father-in-law one day came to visit. We had a little pond on our property, and he used to go down and fish for these really small bass. He would just catch them and throw them back in. But he came, he was feeling great. He went down to the pond, he fished for a little while. He came back up, and I would say probably within about an hour of coming back up, he's sitting in a chair, visiting, talking to us, and he starts really looking horribly bad. And I looked at him and I said, "What's wrong?" And he said, "I don't know. I just really suddenly don't feel good." And I said, "Have you been feeling okay until now?" And he said, "Yeah, I was fine. You saw me when I came here." And it's like, yeah, you know, he looked fine. And he was a cancer survivor, and he was older, but I think that's really his biggest health issues. And he was a smoker, but he had quit, you know, not that long before. He then started shaking like I have never seen anybody shake. His whole body just started going into shakes, and his skin got kind of like this, people describe mottled skin. Mm-hmm. And it just, yeah, that's kind of how it looked. And not understanding what was going on, I called 911, fortunately, because that didn't look good. He did not know it, but he had a urinary tract infection. But a lot of times seniors don't feel the symptoms of an infection necessarily. And so they don't know that they've got one. And so I just wanted to share with people that it comes on. When Sandy said fast, she's not kidding. I mean, going from just having an infection to becoming septic comes on really quick, and it progresses very, very quickly. It might not be a couple of hours like it was with him, but you really have to be aware. You have to know what's not the normal for the person that you're looking at or talking to or dealing with. I was doing a Sepsis 911 presentation a while back, and we are available to do those throughout the state of Connecticut. And we were doing it at one of the senior centers, and we had some EMTs in the room, and, you know, one of the women said, "The symptoms sound like the flu." Mm. And, you know, if I called 911 every time I felt like I had the flu, you know, they'd get annoyed with me. And the EMTs said, "We'd rather that you call us and let us make the determination, because if they didn't call and it was sepsis, the time that was spent deciding to do it or not to do it and everything else was really wasted time, because, as I said, once it goes bad fast. Do you see that a lot, though, Sandy, where people don't come to get care because they just feel like maybe they've got the flu and they don't want to be a bother?
That's exactly what it is, because, you know, again, the symptoms mimic so many other, you know, diseases. It could be flu, it could just be a cold, it could just be you're feeling out of the weather, you're tired, you're, you know, you're exhausted. It runs the gamut. But I think looking at the combination of those, if you have, you know, a combined, like, you know, fever and chills and shortness of breath, and your blood pressure is running low and your heart rate is elevated, you know, that's something that should ring a bell. For folks in terms of, hey, do I need to seek escalation of care?
Yeah, and I would say from my experience that you would certainly at the very minimum want to call your doctor and fly it by them. And what somebody else suggested to me was, say, I'm concerned that I might have sepsis, just in case they're not thinking of it, because then they might be able to put it together more appropriately in their determination of, you know, your diagnosis.
And you hit on something really important, advocating for yourself and saying, I'm concerned I may have sepsis. They may be shocked, like, well, how do you know? But hey, let them know that you know the signs and you are well aware and you are advocating for yourself, so that you need to be properly worked up.
Okay, and the other thing is, do you need to have like all of the symptoms, or can you just have some of them and be septic?
Yeah, it doesn't, you know, every patient physically, their bodies are different and how they react to things. It's like, you know, someone's experience with birth is going to be completely different from another person's. So, you know, I may be septic and I only have shortness of breath, or I have really bad chills, or my white cells are elevated. But typically you'll have 2 or 3, not all the same, but among those, I don't know, 6 or so that I mentioned, you'll typically find, you know, elevated white count, the tachycardia, the hypotension, the shortness of breath, the chills, the fever. You know, you'll have some of those. Yeah.
You know, I also want to mention that there are cognitive changes too that come with it sometimes.
Yes.
My husband went septic several times, and he hallucinated on at least 2 of the occasions. And I think he just liked to hear himself talk oftentimes. So he would describe his hallucinations, at which point we knew he was definitely ill. But it does cause cognitive change. And it can be as severe as hallucinations, or it can just be a little bit of confusion.
Sorry, I'm just moving because I have to charge my computer. But and I'm glad you brought that up, because I didn't mention that just now, but I mentioned it in the presentation, that yes, change in mental status. So if someone is all of a sudden confused, hallucinating, again, those are certainly some signs that you're going to want to look out for. So I'm glad you're able to share that experience. And I'm sorry for walking around.
It's okay. You have a really nice house. Are there any other questions that anybody has? Because we have the luxury of having Sandy available to us. Sepsis is a, you know, as we've emphasized, it's a really serious problem. It's absolutely under-recognized. Even healthcare providers, oftentimes, as Sandy mentioned with her uncle, don't put 2 and 2 together. Mm-hmm. Or was it Carl Flatley's daughter?
Right, and
they don't put 2 and 2 together. So, as Sandy has said, self-advocacy is really important. If you don't feel good, don't let somebody just dismiss it.
Right. Ask
them questions. Could I be septic? Do I have it? Have you confirmed, do I have an infection or not? And you know, there's the story, one of the first times I ever heard about sepsis actually was Rory Stanton, the 12-year-old boy in New York City, who like scuffed his arm or his knee on a gym floor, right? Mm-hmm. And became ill, you know, shortly after, within I think a day or so, and they attributed it to him getting like the flu or something. Mm-hmm. Because who would think a 12-year-old boy would get something so serious, and the only thing he had was this scrape. It wasn't even like a gash.
Right.
So it doesn't take a huge infection. It can be real subtle.
Yep. Yep. And I mean, surgery places you at great risk because with the example I give about Erin, she went in for a simple procedure and, it's hard to really pinpoint at what point in time that, that sepsis can take place. But it's important that we do know, hey, the signs are there. We know that for sure. And if you see them, it's like, when you're in the New York City train station, if you see something, say something. If you're seeing symptomatology that you're not sure of, call your doctor and say, hey, I know this might be kind of out of a limb, but here are my symptoms. Could I be septic? They can draw blood work, and they can take a look at the blood work and have you come in and rule it out. It's not, something that is unheard of. So.
And Sandy, what would somebody, if they do go to the hospital and it is believed to be sepsis, what is the treatment protocol these days? Like, what should they anticipate happening or expect to happen?
Yeah, oftentimes they'll draw what they call a rainbow of blood work, and they'll draw, if you ever look at the tubes, they all have different colors for a reason. So a light purple or lavender top usually is a CBC, and they'll have a chemistry. So those panels all tell a story. So they're looking at your white count, they're looking at your electrolytes, they're looking at your lactic acid. They'll probably draw blood cultures to see if there is any infection in your blood. And then they'll immediately start you on a broad spectrum antibiotic. And it could be antibiotic of choice. Oftentimes it's a medication called ceftazidime, it's a cephalosporin, and they sometimes will put you on another one called vancomycin. It depends on what their thought process is, and every protocol is a little different, but the medication itself is pretty standard. The antibiotics, they call them broad spectrum, is because we're kind of shooting blanks and we're not sure, you're shooting in the dark and we're not sure what exactly we're trying to kill, but we know that these will kill most if it is an infection. So they start you on that until they really are able to identify what organism is causing the infection. And then they'll get something more specific.
It is also one of the components that I remember hearing early on, that they try to almost not overload you, but heavily load you with fluids. And I know there was debate about that back then. Is that?
Yeah, no, if oftentimes because you're hypotensive, they'll give you bolus of fluids, they'll give you hydration because they want you to become normotensive. They want your blood pressure to normalize. And so giving a fluid bolus will help with that. And hydration overall is not a bad thing. It helps just kind of your body bounce back and get back to normal. And so it's usually like an antipyretic. The Tylenol and Motrin I talked about, it's the broad spectrum antibiotic, it's the rainbow blood work, it's the blood cultures, and oxygen if you need oxygen, and the antibiotics. I think I mentioned that.
Okay. Are there any other questions? I mean, I feel very privileged because Sandy and I have been able to have this conversation back and forth.
Hi, this is Hannah. I actually have a comment and also a question. In the meantime, if we somebody's experiencing the sepsis, and while we wait for the ambulance or emergency to come, is there anything that we can do, like to give or to make the person feel more comfortable, or to at least delay what when it becomes like really bad?
Yeah, that's such a good question, because sometimes you're like, oh gosh, should I get ready to do CPR? Like, how bad is it gonna get? I think really being there to comfort and support the person, immediately, if you can get the patient's medical information, because that's going to be helpful. If they're taking any certain medications, their medical history, any other encounters, or if they've had sepsis before, any allergies, that's going to be really important when you're going into the emergency room, giving the information on the patient. Helping to ease their mind as much as possible, especially if they are confused, hallucinating, if they're really hot, and if they're uncomfortable, just trying to keep them comfortable and cool, and ensuring that, they're okay, that you're going to get the proper help that they need. But as much information you can gather about the patient, sometimes they'll have a medication card that has the list of all their medications with them, all their insurance information. I think that's probably the best thing you can do. If they are able to take in fluids, certainly allow them to take in some fluids, come in with a little bit of a detail of, at 7 o'clock, I noticed you were super lethargic. And then at 8 o'clock, I noticed that they started running at temperature. And now it's 9:30 and their blood pressure, their heart rate is racing. So trying to timeline it would be helpful.
Okay. Thank you.
Good question, Alba. Yeah.
One comment that I make that I have is that this is especially more threatening to women, because we tend to put everybody else, treat it as a priority. When we have any kind of symptoms, we always think it's just a minor thing. It's just I have menopause and I have, we try to, especially in the Hispanic culture, we come from a culture that we put children first, house first, husband first, dog first, cat first. And if we have any time left, then we take care of ourselves, if any. So when we experience any type of symptoms, we always leave it for we always assume that it's just a minor thing. We don't really think it as an emergency or something. And that's why probably it's one of the factors or the risk factors that why Hispanic or women in general are high on deaths and visit the emergency at the very last minute.
Yeah, I mean, to that end, it's so important. That's why we maintain our health and go to your regular doctor's visits, get your normal immunizations and get your normal health screenings done, because, one of the risk factors is chronic conditions. So at the bare minimum, try to keep yourself at least healthy and do your regular maintenance checks. Like I always say, I have to be like my husband, like he doesn't miss things when it has to do with his car or anything like that. And it's like when it comes to do with your medical appointments, it's like, oh, I forgot, you haven't had a physical in 2 years. But you change your oil early before you were supposed to. So it's really important to kind of maintain the basic care, but yeah, you have a good point, Alba.
Are there any other questions that anybody would like to ask, or any comments that, somebody wants to make?
I would like to ask something. My name is Karime Pimentel. I'm the coordinator for the Connecticut Center in the Waterbury area. We did a workshop yesterday. I understand we are talking about sepsis, but it's related to the COVID. Somebody asked me if it's true, if your blood type is O positive, you are exempt to get the COVID-19. And I say, I don't know, tomorrow or next day, I asked to Lisa about it and Nilda too, because I don't know, I'm not sure. Do you have any information about it?
Yeah, I did see an article like that recently. I didn't read the whole thing. I think it's hard to say. I mean, we have, I know in New Jersey, we're reaching over 200,000 people infected with COVID and close to 15,000 that died. I mean, I love to see those numbers to see that not one person of that 200,000 are COVID-19 positive. I don't know if I could say that. It might be a correlation. We might see that lower incidences of people who have that blood type are getting COVID. I think there's so much that we're learning from COVID. Like COVID is like the Sunday school teacher in many ways, that just unveiling so many things that we didn't know and just kind of helping to open our eyes. So I'm excited to see. It's weird to say excited because it's nothing to be excited about, but I'm looking forward to seeing what we find out from COVID. But I did hear that.
Okay. Thank you.
Do we have any other questions?
Hi, I just want to comment that, Cindy, how, I don't know if you have been seeing patients that are, have a little chronic breathing problems, and COVID patients that at the same time is like a septicemia condition. I mean, how confused can be those both diagnoses. I mean, they can see you and they say, oh, you flare up, your COPDs flare up, or you have some infections, and they don't do nothing now because you already have a diagnostic, and they don't know that probably you're going through sepsia because the
Yeah, no,
infection.
it's so hard. I think it takes some astute clinicians. It takes us really educating our clinicians to know better, because again, I can see patients who have shortness of breath, they have COPD, and you're right. You might say, oh, they're having a flare-up, but what's different this time? Do they have a fever? Have they normally had fever? Are they having chills? Are they having a change in level of consciousness? It's really educating also our providers to know the differences, because the nuances are small, but they're important in those details. So we have a dual role as providers to educate ourselves and as patients to educate yourself, because we can miss it. And so it's really important.
Thank you.
Thank you, Nilda.
Do we have any other questions or comments?
Well, you have my information, Lisa. If anything comes up, please share my email with folks. I'm happy to get on the call or shoot you an email. This was really an important conversation. So thank you so much for having me. I really appreciate it.
And thank you so much for giving up part of your day to be here with us. It is an important conversation and worthy of repeating. We are going to post this webinar on our website and on our new YouTube channel, so that hopefully it will be shared with others and more people will be able to learn. It is important to make the connection between COVID-19 and sepsis. It's very interesting. I heard a comment the other day from one of the naysayers that it's not all these deaths, they're not COVID, they're being caused because of diabetes and everything else. But it's kind of really the reverse. It's that, and sepsis is the third piece of the puzzle actually, but it's that you live with diabetes. Then you get exposed to an infection such as COVID, and it's harder for you to fight it, and then it becomes sepsis. And then unfortunately you succumb. But I think it's very important to realize that when you have something that compromises your ability to fight other illnesses, that you do have to be more cautious, you have to be more aware, you have to be more mindful of changes in yourself, because it's not always so obvious, it doesn't always jump out at you. And Alba, where you commented about how women don't see the symptoms because we're always just caregivers for others. The flip side of that is that I think men are so in touch with their bodies, to my experience. But very often it's like, it's bothering me a little bit, but I'm okay. They don't even, it doesn't even cross their radar that they might be sick, whereas we might be aware that we're sick, but we say, oh, but I have to take care of this one and the other one first.
Yeah, that's
so, you know, so I think we just have to be aware, because there are these illnesses and these conditions that creep up on us, and if we let them go too far, they've gone too far. So Sandy, thanks again so very much for sharing your time with us. I do have your email and I will use it should I need it. And if anybody has questions, please forward them to me. We are at www.ctcps.org, and there is a page where you can contact me. Nilda, thank you for being on the call. Nilda is on our board and she's awesome. And Sandy, you're going to be a board member in spirit at the very least.
Thank you so much, guys.
Yes, thank you very much. Thanks everybody for attending, and we will post this up on the website and our YouTube page.